Are beta-2 agonists effective for cystic fibrosis breathing? Beta-2 agonists are a type of inhaled bronchodilator. They work by relaxing the smooth muscles in the airways, which helps to open them up and improve airflow. For individuals with cystic fibrosis, these medications can offer some benefits. They help relieving airway obstruction and improve mucociliary clearance, which is the process that helps move mucus out of the lungs. However, it's important to note that the effectiveness of beta-2 agonists in cystic fibrosis is usually not as strong as it is in other respiratory conditions, like asthma. Short-acting beta-2 agonists typically start working within about 15 minutes, and their effects can last around 4 hours. These medications are often used to relieving acute airway obstruction during flare-ups. They can also be helpful before physiotherapy or mucolytic treatments, which aim to clear mucus more effectively from the lungs. Some studies show that beta-2 agonists can improve lung function measures, such as forced expiratory volume in 1 second, after exercise in adults with cystic fibrosis. This indicates that they can help improve airway openness and breathing capacity. However, responses to beta-2 agonists can vary among cystic fibrosis patients. Unlike asthma, where bronchodilators consistently improve airway function, the airways in cystic fibrosis may sometimes react differently. Some patients may experience paradoxical bronchoconstriction, which means that instead of opening the airways, the medication might worsen airway narrowing. This can happen due to structural changes and bronchiectasis, which is common in the lungs of people with cystic fibrosis. In summary, beta-2 agonists can be useful as part of the management plan for cystic fibrosis. They help open airways and facilitate mucus clearance, especially during flare-ups or before airway clearance therapies. However, their effectiveness is generally moderate. They should not be viewed as a standalone treatment, but rather as part of a broader approach to managing cystic fibrosis. It is crucial for healthcare professionals to monitor their use to ensure that these medications provide benefits without causing adverse effects. Since responses can vary based on the severity of the disease and individual lung conditions, personalized medical advice is always essential.